Welcome to Revive Health's daily briefing live for Wednesday, April 8th. Our 30-minute review of the latest, most important news, resources, and advice for health system marketers and communicators dealing with COVID-19. I'm not Chris Bevelo, your normal host. Chris is got a prior commitment today, so my name's Jeff Speer. I'm your guest host today, senior strategist at Revive Health. Chris will be back tomorrow and do all the great things he always does. Today, joined by Chase Kleckner, Senior Marketing Manager at Revive Health. Hi, Chase.
Hey, Jeff. Good to have you here.
Thanks. Appreciate being here. Chase is our show producer and makes everything happen. Also today, we're joined by Ben Fuqua, VP of Analytics at Revive Health. Ben's been practicing analytics for more than 25 years and joined Revive Health several years ago from HCA. Ben, how are you today?
Hey, Jeff. I'm great. Thanks for having me on.
Ben, can you just tell our listeners here a little bit about your background?
Sure. I've been doing analytics across a number of industries for a very long time. Got involved in marketing within retail and travel and transportation, started doing a lot of customer centricity work, which we bring to kind of our approach for communicating with patients for our health provider clients. So great place to be.
Thanks for joining us, Ben.
Sure.
Okay, we're gonna get started here. Just a couple of our normal caveats, information, and disclaimers for the show. So as with each show, we'll cover the latest news, how it relates to marketing communications, give you a couple of resources today that hopefully be helpful. As we move through, please, if you've got questions, use the question queue in Zoom to line up your questions, and we'll get to as many of them as possible, probably about 5 to 10 minutes at the end of the show. You can also use the chat function to talk to other attendees, but if you want us to answer a question, use that Q&A button. You can also subscribe to the podcast on iTunes now. Search for Revive Health Daily Briefing Live. We'll be posting the recording of the episode by the end of today. You can also get it from our website at thinkrevivehealth.com/COVID-19. There's also other content up there, including consumer survey that we're going to be talking about today. Finally, a couple other notes. We are not experts on COVID-19, so this is not a place for medical or scientific advice. We do have opinions on marketing communications and how many of you can use this information we're talking about today, manage through the crisis and post-crisis, but everyone's situation is unique. So we understand, make the decisions best for you. You can always check in with us if you want to talk more. Chase, did I cover everything I was supposed to cover?
That was excellent.
All right. So let's begin. We always want to start with the latest count of cases and impact of COVID to keep tabs on how the crisis is growing globally in the US and hopefully soon how it's proceeding. That context is always important. We don't want to overlook it. So we use Johns Hopkins tools for that. And we've got a link there. But today, right now, as of the moment, 401,166 confirmed cases in the United States, 12,936 deaths. And the uptick is big.
Yeah, Jeff, really, I think we've heard that this is going to be a difficult week for a while, and the numbers aren't slowing down at all.
No, and I live in California. Chase and Ben are in Tennessee and Nashville. And even in Los Angeles yesterday, they've asked everybody not to even leave their homes for the week, not to go to the grocery store, because they think it's an important week to keep the peak down and try to flatten that curve. Has become a lot of things we talk about these days. Okay, wanted to talk about one other resource that we just learned about today. Crisis text line has been around for a while. It helps people that are dealing with anxiety and depression and stress. It's exactly what it is. You text somebody if you feel like you need someone to talk with, and you get a counselor texting you right back and just helping you get through things. I've done some work on mental health before. It's a really, really phenomenal service. It's free for people, certainly there for people who might be feeling depressed or sad or thinking they might want to hurt themselves. And today we learned that that the crisis text line has launched a new free service specifically for frontline healthcare workers and essential workers. All of our listeners understand, I'm sure, the trauma and things that nurses and physicians are going through right now, but also not just the people helping those and caring for people in the ICU, but others that are watching their colleagues go through it, or maybe are suffering some other stresses due to not being able to work. Most of our clients have really great EAP programs. I'm sure every health system across the country does, but at the same time, there are people that are averse using EAP programs. So the crisis text line is a really great resource, and can be something that you should maybe share with your workforce. It's anonymous, it's free, and it's via text, so it's easy and quick.
Jeff, there are a couple of other resources that I want to bring up as well, if that's okay. The Institute for Health Metrics and Evaluation, IHME, has started building they've built a model that predicts peak by state. So I don't know if everyone's seen that. That's the IHME associated with the University of Washington. We're starting to think about using this for local level planning with our clients and understanding when peak projections are expected to hit. As with all models, they're going to be, somewhat wrong. We don't know exactly how right they are, but it gives us an indication of when we expect to see peaks by market.
Yeah, Ben.
Yeah, go ahead.
I was going to say, I saw that as well. And one thing that for the listeners out there that are in charge of communications right now and working with their health systems on that, and closely with their states and governors and Department of Health, that might be something to look at, because there may be some discrepancies there. For example, projected bed shortage in your area. And if consumers are seeing one thing and you might be projecting another, probably important to understand that and be able to communicate around the differences.
Right. And you and I talked about this briefly, but those are at a state level. And I got to think, a state like California, a state like here in Tennessee, that's geographically so long or big, those are state level resources. So the idea of making those resources available to some of the rural communities, or having people come into the larger communities for care, it becomes more difficult. So that's one reason we've started looking at a second data source, which is the COVID Alliance, which is an MIT group that spun off, created forecasts for risk at the county level. Their forecast is based on a couple of different clinical conditions like hypertension, diabetes, and obesity, but it gives you a risk score at the county level, so that when we do start to see the epidemic hit those rural locations, you know which ones are at higher levels of risk. So you can start to plan around, that peak combined with the local county scores.
Yeah, and I think that leads to one of the articles I thought today, or last night actually, maybe. But the New York Times has an article right now about that very issue, about the spread to rural counties starting to happen. And I think we all know in healthcare about the challenges that rural communities have with healthcare. The article did say that in the last decade, about 120 hospitals in rural counties have closed, and more now. There's, I think, some that have closed during the pandemic. So for our listeners out there, I think for health systems that maybe are in rural counties, but also those that aren't, think about how you can partner together with somebody that may not be right in your vicinity to figure out how resources can be shared in ways that maybe normally wouldn't have to do, or that you do in other shared service lines, not just in care or preparation, but even in communication and engagement with the community, which we're going to talk about a lot today. So we'll come back to that point. But let's get into that. We, as some listeners may know, a few weeks ago, we did a consumer survey right near the beginning of the pandemic, and it revealed a lot of really interesting things. And we thought it was really worth doing again, and understanding how things might be changing or not changing for consumers, particularly what they want to hear from hospitals and health systems for, as well as a few other new questions. So we wanted to focus today's show to talk about those findings a little bit. They're on our website in the think revivehealth.com. COVID-19. But Ben, real quick, before we get into the findings, can you just introduce the survey a little bit and tell our listeners a little bit about the methodology?
Sure. So we initiate a survey through a company called Pollfish. We design the questions that we want to ask, issue those through a series of existing applications, so consumers are not being asked to go to a site to do something. It's embedded in their normal active use of existing apps. And it's presenting the survey principally mobily for them to answer questions that we're posing through the research instrument. We're getting back 700 responses, which for the national level is statistically significant at 95% confidence and with a 4% margin of error. I know that we have put out a dashboard that allows us to drill down to some of those elements and start to parse out regions, states, different demographics. A word of caution on that: the results quality is going to change when you start kind of drilling down to the smaller samples. So keep that in mind. So like you said, we fielded the second questionnaire. In this questionnaire, we kind of moved away from some of the channels and asking information about the channels necessarily, and started to focus more on the how does the healthcare provider continue to communicate, what frequency, what sorts of information, where is the consumer mindset wise, what are they thirsting for, what do they want to hear, and then what are they experiencing personally during the episode, as individuals, how is it impacting them?
Yeah, in thinking back to the first survey, we found that pretty revealing. Number one, that people really trusted hospitals and health systems more than almost anybody else. Another finding is that people were basically worried about everything. Finance was top, but was kind of surprisingly, the second, I think, thing people were most worried about was the physical health of their family, unrelated to infection. And then we also saw some things around telehealth. So let's get into a few of the main findings from this one. Ben, what do you have for us today?
Sure. So again, thinking about the thirst that consumers have for information, you and I are talking about this as to the frequency that we're searching for, news and updates. Everybody else is just like us. There's a high level of daily, inside of the day, search for information updates that consumers are expressing. And again, in our survey, we saw that the preference is for that information to come from local healthcare leaders and from local leaders, followed by national healthcare experts.
Yep.
So that demand, that thirst for knowledge is still there, that thirst for information, for updates, it's still at a daily basis and inside of a day.
And that thirst is big. We saw that New York Times, for example, their readership has jumped 100%.
Yep.
That's a lot. And for our hospitals and health systems, I think they're cranking out information, and they probably think they're pushing out a lot. But this seems to say that there's probably more they could be pushing out.
I think it does suggest that at some point the health systems have to decide how much they can push out. But I'd say the demand or the interest is there for daily and inside of a day. So the idea of using websites as communication tools, the idea of using electronic newsletters or push notification of some sort is valuable, and I think at this point hoped for by the consumer base. That's what we're seeing.
What were some of the topics? We definitely asked about things they're interested in. Can you talk a little bit about what the survey showed there?
Yeah, sure. So there's still an expectation. I think I have a friend who's a newspaper person in West Tennessee, and he always says all news is local news, right? Nobody cares at the national level so much. They want to know, what does it mean to me? What does it mean locally to me? So community level updates, what's happening in my market, how many people affected, are things okay, do we have beds, that kind of information I think is hoped for. Where to go for testing. We saw that people still don't know exactly where to go, when the conditions are right for them to go, when the symptoms have triggered kind of that threshold to actually go get tested. So that is something that we saw last time. And then again, this time it stayed very high on the interest list for that kind of communication. Another thing that we saw this time is the idea that people are taking kind of the guidelines very seriously. They're taking the personal protective equipment ideas, the social distancing, and they're putting those into effect. But interestingly, they don't necessarily think that everybody else is.
Right.
So I don't know if it's I'm better than you, I'm doing the right things, you over there, I see you, standing out in the yard, whatever. I don't know if that's exactly what's happening, but there's certainly being communicated the idea that everyone else isn't doing the things that they need to do.
Yeah, that's a pretty common phenomenon, I think, when in surveying, that people have a little bit of better view of themselves oftentimes than they do others. I found it interesting that people still feel like they don't have enough information on testing,
Mm-hmm.
because the implication there to me is something that we always know if you're marketing communication, but I at least kind of overlooked that at this point, which is you have to tell people things multiple times over and over. People take in information and also retain it differently. And then you add on that a crisis, and probably the emotional factors of that impact how people think about things. And even if you were to, I would love to quiz somebody, say, well, what do you think you should do? And I wonder if they'd be right. They'd probably be right, but they still feel like they want more. The other thing I thought was interesting that I think will be increasingly a challenge for health systems is the information people want about cost. Never an easy topic for us to deal with. And certainly would think that'd be something that the health plans and others would be really there to provide for consumers, and just make sure they know, get treatment, and that's number one. But it seems like that may not be a message getting out there either. And so I think for us, for our listeners, getting out there with the message, remember they probably are not tired of it, will get tired of it before they think that it's been said. But it's really critical. Ben, tell us about another finding.
Sure. So I think we had asked in the first survey about telehealth and how many people were aware of it, familiar with it, whether or not they had information on how to access it. And that probably was the biggest jump that we saw between the two sessions, is that the awareness of telehealth jumped by 13%. So the communication about, we have this option of telehealth, the probably public communication about its existence, some of the social distancing, I think are all driving people to have a more expressed interest in understanding more about telehealth and what it can provide to them. From the survey findings, I think if I looked really closely, we would see about 71%, and the numbers aren't on this chart, but 71% of consumers are interested in using telehealth at this point, mm-hmm. which I think is, it's the most significant jump. It also says that that option, that care option, needs to be communicated if it's part of the fabric of your care within the community that you have.
Yeah, 71% are interested. That's a big jump from last time, and as well as the awareness. The thing I think is kind of fascinating is that we've been pushing this, the healthcare providers, and certainly virtual care for more than a decade, and now this moment is here. But some of that data still says that while they're interested, they're not necessarily equipped maybe to take action, or they're uncomfortable with it.
Mm-hmm. Yeah, and that comes out when you look at who a consumer is going to reach out to first. They're going to reach out to who they know, right? And that's mm-hmm. their primary care physician. And almost 50%, I think it was in the 40 some odd percent, said that's my first point of contact. So in the event that primary care physician offices aren't open or can't deal with that capacity, I think it starts to be a very good overflow option to put in place.
Yeah,
now, sooner rather than later, pre-peak, So.
Well, and we try not to think too much ahead sometimes, because we are in a crisis, but our jobs, we do try to look ahead. And one of the things I think marketers really need to be thinking about when it comes to virtual health and telehealth right now is you still need to think about the experience, because most systems will want this to be something in some fashion that continues post-pandemic. Of course, we still want patients to come into our offices and that sort, but there is a benefit for consumers if they do have a good experience. It can be very convenient. It could also be more cost effective. So health systems, I think, and marketers in particular, need to think about what are they doing to support a really good experience for physicians and patients, not just getting them the information and knowing, but certainly they're getting the information and make sure they know how to access it. But do you have teams that are available to coach physicians, not just on the technology side, but on how to really deliver a good experience for patients? Because the physicians, many of them that are doing it now, we've got a client that had 6,000 sessions yesterday, which is an unbelievably higher number than they've ever had before. So 6,000, there definitely have some physicians that are just doing virtual care for the first time. But certainly there's things on the patient side too that can make that experience good.
Yep. I think from that, we start to think about how long this is going to last. And that's one of the questions that we asked in the survey is, what's your expectation of the duration for this kind of situation? And 69% of the people that were surveyed said it's going to take 3 months or longer. So I think there's a realistic expectation that we're in for a 3 to 6 to 9 kind of month period before normal is reached again. Right?
Yeah, so, normal.
What's normal going to be, Jeff?
I don't know what normal is right now or when it's going to be.
Yeah.
I think that made me think about two things, I guess, that takeaway. I think it's good in some ways that the consumers are realistic about what's happening, but there's definitely an impact on us. You had mentioned earlier some of the topics they want to hear from us about are wellness topics. Yep. So health systems and investing and communicating about that and engaging people around that. The second is, to me, if they know this is going to be 3 to 6 months, we have another partner where we work with a lot of public opinion surveys that just ran a research study. And one of the fascinating findings to me that I think is going to stick with me, 12% of people said they will never shake hands again. So what does that mean? There's clearly a lot of room between normal and never shaking hands again, and people being in this for 3 to 6 months. So for healthcare providers, what kind of information should they be thinking about getting to people beyond just COVID right now in their homes as it relates to care?
Right. And that's one of the things that we keep inquiring about is the level of expectation that consumers have specifically from health systems on that kind of topic. And you mentioned earlier that concern for family well-being was among the top kind of responses. So anything that helps people navigate this time where we're not normal, where you have to isolate in place, where you're with your family unit right now, whatever that is, the mental well-being coming through that, the physical well-being, maintaining exercise, putting boundaries in place so that we're not working 16 hours a day, which we kind of maybe do, but
right.
But putting those boundaries in place so that the backside of this doesn't look like just this wasteland of people that are emotionally, physically, exhausted, destroyed, and the implications of that on the health system later on. So, and we heard the request, communicate things like that. A very strong interest in communicating anything that helps people maintain that wellness during this time period.
And we have an advantage right now. People are actually wanting and paying attention to us and expect it from us. I think, though, it's an advantage that we can't take for granted. We still have to be differentiated in our messages. We have to deliver it in a place that they can see it. We are still competing for their attention, and we can't let that go. So, Chase, I think we've covered it. Any questions that we can get into?
I think the question I have is, how long do I know we mentioned like we don't know how long this is going to be, And Ben, you mentioned some things on wealth or health, like kind of general health guidelines. But how long do we communicate around COVID as a system? And is there other content that we need to be pushing out either afterwards or just at the same time?
Ben, you wanna go first on that one?
Sure. So I think with the peak information that we're seeing from the IMHE, we have an idea of how long it's going to be until we hit that peak saturation point for health system demand. I think absolutely the guideline communications keep going through that time period. The consumer response, I'm following the guidelines, everybody else isn't, suggests that it makes sense to keep that message going. And Jeff, I think you made the comment, you don't just get to say it once or twice, one PSA, two PSAs, you got to keep it running, 7, 8, 9 touch points. We've also seen flattening of the curve models that are starting to suggest that fewer people are going to be infected and suffer mortality as a result. And those are reflecting positive adoption of those guidelines. So anything that keeps that kind of thread, communication, suggestion, recommendation going is crucial. And through the peak period.
I totally agree. I think there's a couple other things to think about on COVID information specifically. So COVID-19 information specific to at-risk populations who have been maybe not been able to get care because it's not emergent condition, but maybe things are getting worse for them when they're not getting the chance to go see a routine appointment. And they're wondering how they should be taking care of themselves, or maybe the caregiver, somebody in their family that doesn't necessarily have to think about this as much, as now worrying about their condition and how to help take care of themselves. So health systems, I think, really can get specific personalized information out to these at-risk populations, some of it related to COVID-19, some of it just related to their condition, and helping them feel confident and informed and knowing how to manage these things, and when to say, yes, I need help, and I need help right now. So all your websites that have service line information or specialty information, we should be directing people and have some custom information there. There's also, of course, I think the opportunity for people that have scheduled appointments that couldn't go to stay in front of them. So whether it's a hip surgery or some skin condition or something else, it doesn't mean, hey, call us when the pandemic's over. That you can really win a lot of loyalty, and also, of course, help people get through this by personalizing communication, staying in front of them, maybe utilizing some staff even to just place calls, staff that can check in on people, make sure they're doing okay, maybe direct them to virtual care if that's appropriate. I think those are really important things. And then lastly, it's definitely not too soon, I think, to plan for if you think your area is going to be out of the peak in a month, there will be pent-up demand for your services. So thinking about those things, not only talking to your staff about that, but of course, starting to make sure that you've got plans in place to market those services is really critical. The last thing I'll say on that is your workforce. I think every health system I've talked to is doing a tremendous amount to celebrate their workforce. They know what's happening and supporting them, but that has to go for a long time, because they are also going to have a lot of challenges coming out of what's happening right now, but then dealing with how things will flip in 3 months for the system and kind of go up and down. So I think we are right at time. Am I good, Chase, to wrap?
Yeah, I think let's wrap it.
Okay, well, thanks everybody for listening, either live or who've downloaded the podcast. If there's anything you want us to cover, please post it in the Zoom chat now, or just reach out to Chase and I through the website. Tomorrow we've got a great host. Chris Bevelow is the host. We also have a new guest, Steve Telliano, who's the Assistant Vice Chancellor of Strategic Communications at UC Davis in California. They were actually the first medical center in California to have a confirmed case, and they're doing a lot of things. So Steve's going to talk about maybe some of the unique challenges from academic medical center. Thank you, Ben, for joining us today.
Happy to, Jeff. Thanks for having me.
Appreciate it. And remember everyone to visit our website, thinkrevivehealth.com/COVID-19 for a recording of today's episode, and get additional content, including the survey that Ben walked us through today. We'll be happy to answer any questions there. There's also a great dashboard, as Ben said, where you can dive into yourself. Please tell others about the podcast who might want to listen. Finally, to all of you out there, hang in there, keep up the amazing work. The skills you bring to your organizations as marketers and communicators are more valuable than ever right now in helping us move through the crisis. So we'll be back tomorrow and every weekday until this all passes. Talk to you then.